This instructional video is intended for the Operational Medical Support Unit, focusing solely on the medical aspects of incidents. It does not address proper tactics for fugitive operations.
Our target's going to be Roman Garber. He's wanted for malicious wounding and assault. Our target address is going to be 121 Morewood Court. We have surveillance up at this location. Surveillance cameras shows that he's the only occupant inside the residence. Surveillance has been going for the past 24 hours. He's confirmed inside the target residence. Warrants in hand. Breacher is going to be Mel. Medic is going to be Detective Ramirez. Once we make entry inside the residence, that first room should be the kitchen area. We're going to establish that as a casualty collection point in the event that we were to need to or have a wounded officer. Are there any questions?
Where are the keys to the medic vehicle going to be?
The keys are going to be in the center console of the gray.
Before any operation, conducting a thorough briefing is essential. A well-prepared team operates more safely and effectively. During the briefing, it's crucial to evaluate potential medical risks based on intelligence, terrain, and operational factors. Assign a dedicated evacuation vehicle, ensuring it's fueled, ready, and accessible. Clearly communicate the location of the vehicle's keys to prevent delays. Designate both primary and backup drivers for the evacuation vehicle. Identify the lead medical provider and ensure they have all necessary supplies. Establish a predetermined casualty collection point, CCP, for stabilizing casualties before transport. In high-stress situations, maintaining composure is vital. Tactical breathing is an effective technique to stay focused and make clear decisions under pressure. The method involves inhaling deeply for 4 seconds, holding the breath for 4 seconds, exhaling slowly for 4 seconds, pausing for 4 seconds, repeating as needed. This controlled breathing reduces heart rate, improves oxygen flow to the brain, and enhances mental clarity, enabling a measured response in critical moments. Now, let's consider a scenario where a deputy has been shot in the back room of a house. Once a threat is encountered, you have 2 primary options to neutralize it: firepower, or creating distance and finding cover. TCCC consists of 3 phases. The first phase, care under fire, occurs while the casualty is still in a hostile environment. The second phase, tactical field care, begins once the casualty is moved to a relatively safe location. The final phase, tactical evacuation care, occurs during transport to a higher level of medical treatment, whether by ground or air. If able, instruct the wounded deputy to move to cover. If they cannot move, assess the risk before attempting retrieval. Encourage self-application of a tourniquet for severe bleeding if possible. Once the threat is mitigated, approach the casualty to begin medical treatment following the March assessment. It stands for massive hemorrhage, airway, respiration, circulation, and head injury/hypothermia. Controlling massive hemorrhage and ensuring an open airway must take precedence, while more advanced treatments should only be performed when the situation allows. Responders must treat casualties while maintaining situational awareness. This is known as stacking threats. For example, if you're in a room with only one door, you should position yourself so you can maintain visual contact with that door while simultaneously treating the casualty. If you identify a life-threatening bleed, especially from an extremity, you need to act fast. First, locate the source of the hemorrhage and determine if it's a compressible bleed. Once identified, apply direct pressure using your knee. This allows you to use your body weight to control bleeding while freeing your hands for further treatment. While your knee maintains pressure, your hands can retrieve and prepare hemorrhage control equipment like a tourniquet or combat gauze. During this time, keep your torso oriented toward the threat zone so you can remain tactically aware while managing the medical emergency. Once your equipment is ready, apply the tourniquet high and tight on the limb, or pack the wound with combat gauze and apply steady pressure for 3 minutes, then secure it with a pressure dressing. The key is to remain a combat-effective responder. Never lose sight of your environment and never sacrifice tactical safety for medical tunnel vision. A team should consider moving casualties to the Casualty Collection Point, CCP, once the immediate threat is neutralized or suppressed enough to allow safe movement. This decision is based on factors such as the severity of the casualty's injuries, the availability of cover, and the team's ability to provide security while transporting them. The priority is always to first stop massive hemorrhage, secure the airway, and stabilize the casualty as much as possible before initiating movement. If the environment remains hostile, casualties should only be moved if leaving them in place poses a greater risk than evacuation. When it's time to move a casualty, having proper packaging and movement aids can significantly improve efficiency and reduce further injury. Shower curtains, blankets, and rugs can serve as makeshift stretchers, allowing a team to drag a casualty across the floor with minimal effort. When you have cover, but the threat may still be active, such as when a house hasn't been fully cleared, you are in a tactical field care phase rather than care under fire. This means you have some ability to provide medical aid, but security remains a priority. Regardless of the method used, teams should ensure good coordination and security throughout the movement, using a combination of firepower and concealment to protect both the casualty and the rescuers. Upon arriving at the casualty collection point with their injured teammate, the team promptly provides a MIST report to ensure a seamless transfer of care. The MIST acronym stands for Mechanism of Injury, Injuries Sustained, Signs and Symptoms, and Treatment Given. The mechanism of injury involves a gunshot wound sustained during an exchange of fire in an urban environment. The injuries sustained include a penetrating gunshot wound to the right leg. The signs and symptoms presented are shortness of breath with vital signs pending. The treatment given consists of a tourniquet applied to the upper right leg. Upon receiving this information, the team begins a thorough reassessment, following the MARCH algorithm, a systematic approach used in tactical combat casualty care to prioritize treatment. Initially, they inspect the tourniquet applied to the upper right leg to ensure it is effectively controlling the bleeding and has not loosened during transport. Tactical evacuation care begins when the casualty has received all possible life-saving treatment in the field, and the tactical situation allows for coordinated movement to a higher level of medical care. Once you determine that it is safe and appropriate to move the casualty, you should coordinate movement with your team, or if alone, ensure the route to the vehicle is clear or has cover. Use a drag or carry technique that matches the casualty's condition, your physical capabilities, and the terrain. During transport, continue to reassess the casualty by following the order of priorities. Maintain bleeding control, check that the airway is still open, ensure that breathing is adequate, observe signs of blood loss and shock, and protect the casualty from the effects of cold. By systematically following the MARCH algorithm and utilizing the information provided in the MIST report, the team ensures comprehensive care for the casualty, addressing immediate life-threatening conditions and preparing for safe evacuation to advanced medical facilities. Always have an updated medical threat assessment and discuss it in the pre-operational briefing to ensure everyone is prepared. Tactical evacuation care is not simply a ride to the hospital. It is the continuation of critical care during transport, ensuring the casualty remains stable and that you both arrive alive and ready for the next level of medical treatment. I know it seems like a lot of information thrown at you all at once. Just take a few tactical breaths and relax. We'll go through it together and break it down step by step.